Good afternoon. Welcome to Brooklane's Facebook Live event. Today, we're talking about what are co-occurring disorders. I'm Kurt Miller, Director of Public Relations for Brooklane. Thank you for joining us. We are offering our Facebook Live events as an educational tool for the community. It's important to be comfortable with our mental health, and learning about mental health is a great way to start that. Brooklane offers resources on our website, and such as blog articles and videos on our YouTube channel. You will find our upcoming events on our website as well, and so please visit us at brooklane.org. Today's program is in recognition of September being National Recovery Month. Brooklane supports community efforts like Washington Goes Purple and Frederick County Goes Purple to educate the public about substance use and mental health, as well as acknowledge individuals who are in recovery. Our Facebook Live today is titled, What are Co-occurring Disorders? And it is presented by Amanda Barnhart. Amanda is a licensed certified social worker with clinical at Brooklane's North Village location and with our InStep program there. She helped to actually start the InStep program, and InStep is for integrated substance use treatment. And Amanda works with all kinds of adult clients there and with substance use disorders, mental health disorders, and co-occurring disorders. She's worked at Brooklane for 7 years. And she graduated from the graduated with the Master of Social Work in Clinical Mental Health from the University of Maryland, Baltimore. Amanda, thank you for being here today and presenting with us.
Oh, thanks, Kurt, and thanks for the introduction.
You're welcome.
I appreciate it. Welcome to our talk about co-occurring disorders, which I'm excited to present on today because co-occurring disorders are estimated to affect over 9 million Americans. And so that's a lot of people. And it's important to acknowledge that substance use and mental health issues can go hand in hand sometimes, and to understand what the risks are in having co-occurring disorders. So the real definition of co-occurring disorders is having a mental health disorder simultaneously with having a problem with substance use disorders. And the list of possible combinations of substance use and mental health diagnoses is truly endless. For example, you can have anxiety and cannabis use disorder, or alcohol use disorder and bipolar disorder. In fact, that's a very common combination with mental health and substance use. And people that experience a combination with co-occurring disorders are presented with unique challenges. Anytime we have more than one problem, we have more than one challenge. And so dealing with multiple diagnoses can put someone at risk for more hospitalizations, for more stigma in accessing treatment, and fear about getting help, especially with anxiety. And so it's important that we treat both the substance use disorder and the mental health disorder really at the same time. If we're only treating one issue, the other one could be bound to get worse. Which brings me to the most common and well-known problems with co-occurring disorders that many people know about is self-medicating. So this can be described as the use of drugs or alcohol to alleviate symptoms of a mental health disorder. For example, someone might be very anxious to socialize with others, and thinking that drinking could help loosen them up in social situations. This conversely can lead to addiction and worsening those underlying mental health symptoms. But really, we should normalize it, because nothing's more normal than wanting to alleviate your uncomfortable mental health symptoms. So I think it certainly makes sense if someone is anxious that they would want to resolve that anxiety. And if they've learned that drinking or using drugs helps take away the anxiety, well, it makes sense why they're going to keep doing that. That's why treatment is so important, to be able to find other strategies to healthily medicate the mental health symptoms, because then that person that might be drinking to help them be more social could end up developing a dependence to the substance that they're choosing to use to alleviate their anxiety. Or someone who might use a substance to help them have less mood swings. Well, now you might have more mood swings because you're dependent on that substance. This can be, for example, someone might say, well, I smoke weed because it helps me be less anxious and it helps me be less irritable. But yet this person might come to find that they're becoming anxious and irritable when they don't have access to the substance. And now that substance has become a problem of its own, where before it actually helped you. So these are dangers of using illicit substances or alcohol and cannabis to treat mental health. So many people with co-occurring disorders are only treated for one of their ailments. And we see this a lot. I want to go to therapy to help my bipolar disorder, but I'm not interested in quitting drinking or quitting using. And that's good to seek help for whatever you're ready to seek help for. But we must know that when only treating one of the two co-occurring disorders, that other one is liable to become worse. So if we get help for a mood disorder with depression, bipolar, those kinds of things, you might get a lot better. But you could get even better if you work on your substance use disorder too. And so at what point does substance use become dependence? Like, what is a substance use disorder? And so there's a whole criteria for what constitutes a substance use disorder. But I should note that if you think you have a problem with substance use, you probably do. And we might think that for you to be at a place where you're starting to think, I might have a problem with this, or this is no longer helping my anxiety, and now my family or friends and significant others getting upset, or I'm showing up late to work a lot, then you probably do have a problem with it because you think you do. But how we identify a substance use disorder is through, really, I think it's like 13 criteria. And one of those is when a person is having times where they're having to use more of the substance than was prescribed or intended for a longer period of time. Or more than once a person has wanted to stop drinking or using other drugs, but hasn't had success in stopping for a long time. When a person spends a lot of time using the substance of their choice, or they have to spend a lot of time being sick or recovering from the effects of the substance. Wanting the substance so much that nothing else could be accomplished. This we also call craving. A person may find that using the substance or being sick from the use of the substance often interferes with taking care of home, family obligations, or created like problems in school or at work. a person might continue to use the substance even though it's causing these problems. And continue to use the substance even though it's causing depression, anxiety, or other health concerns. Now, this is the other kind of co-occurring disorder. It's kind of like what comes first, the chicken or the egg, or the nature versus nurture question. Like, do you have your mental health problem and then you self-medicate first, or can your substance use actually cause a mental health issue? Both are true at the same time. Self-medicating tends to be the more common thing people know and talk about, but problematic and harmful substance use can cause emotional disorders. For example, I mentioned before, a person's family might be getting upset because they're maybe drinking a lot and doing embarrassing things. I think we all might know or have seen that in the movies at least. And this might happen all the time, and it's interfering with a person's family relationships. So it could be that that family might start distancing themselves for a person behaving that way under the influence of alcohol or another drug. The person who is drinking or using drugs a lot and their family starts stepping away, they might get really sad about that, feeling very lonely, feeling abandoned. And this is due to the effects of their substance use. That can develop into clinical depression or anger and shame, which can develop into, well, I just want to say depression, or any other, well, mainly depression. We see depression and substance use as one of the most common co-occurring disorders. And so the chicken or the egg, it really can be both. This could be true for people who have experienced trauma throughout the lifetime, such as sexual assault, combat-related trauma, or abuse, physical abuse, domestic violence, abuse in childhood. Many people that have experienced trauma may self-medicate and then develop a secondary mental health condition to their trauma, like post-traumatic stress disorder, and then might also experience major depressive episodes as a result of their substance use. This could happen, and this happens. And so it's really important that both of those things get treated. For an example, someone with post-traumatic stress disorder might decide just to get help for their drinking or drug use, like, oh, I can't deal with this anymore. So they might go to rehab or get involved in some kind of treatment, quit drinking or using drugs. But now the symptoms of their traumatic disorder might become worse because they were using the drug to, for example, prevent flashbacks, prevent high anxiety. And now what do you have to treat those symptoms when you quit using? This is another reason why treatment for both the co-occurring disorders is super important. I really can't stress that enough. Getting into recovery may be a hard decision for many to make, because after developing a substance use disorder, most people also end up developing a relationship with the substance that you're using. You might like it and can't imagine your life without substances. But also the substances are causing problems of their own and preventing you from getting well and living a happy and healthy life that has less problems. So recovery from co-occurring disorders, well, for mental health or substance use disorders or co-occurring disorders, can be considered as a process of change. And involved in the process of change, change through which people can improve their lives and their wellness, health, to live a self-directed life and strive to reach their full potential. And this is what the Substance Abuse and Mental Health Association has a working definition of what recovery is. Recovery means different things for different people. Recovery can mean getting the help I need, being honest with the ones I love, not having to rely on a substance to get out of bed, not using substances and then embarrassing myself, or using in a way that is dangerous for me physically, legally, or emotionally. So recovery means a lot of different things, but we can look at it as a process of change. And this occurs via many pathways. All kinds of people enter recovery in totally different ways and use different supports than others may use in recovery. Recovery is also characterized by continual growth, and it may include setbacks. While setbacks aren't inevitable, this is why people looking for recovery or people in recovery need to have extra supports. And those supports for people with co-occurring disorders must include mental health treatment and to really improve health and wellness. And so that's one step towards recovery, is calling up, going to see a counselor, a therapist, just getting it all out there and starting to process. Do I have a co-occurring disorder? Is it the chicken or the egg for me? Was it my mental health? What caused this? People might have questions about that. And that's something that you should talk about with somebody if you think that's you, or encourage your loved ones to do that. People get nervous about starting recovery, and that's okay. That's normal to experience that, but it is so important. Some people don't think they have a problem at all, and that would be like a first stage of change, being there, not believing there's anything wrong. But then after they experience problem after problem, or anxiety's worsening, depression's getting bad, the drinking or drug use is really increasing, might start to notice some financial problems, social work problems, a person might begin contemplating that they might need to make a change. And that's a really hard place to be, thinking you need to change, but not really wanting to. But there's really nothing more normal than that. Feeling ambivalent about something. We all experience that in some way or another. But when dealing with co-occurring disorders, it can be damaging, I guess. So the next stage of change people sometimes enter to in getting towards recovery is considering developing a plan. How am I going to do this? Who can I turn to for help? I feel hopeless. I don't have energy for all of this, but might start considering seeking treatment or talking to a friend, talking to a pastor, neighbor. Maybe they have a friend that's a counselor. So kind of might be looking up support groups online. So trying to make a plan for recovery. And then start taking actions for it. You might call up Brooklyn and say, hey, can I go meet Amanda? Or somebody to talk through about this. And you can do that. Call them up, tell them you want to see me. I'll try to help you or get you in with one of my friends here. That would be a good action step to take, or to suggest to somebody that you care about that might be dealing with co-occurring disorders. Just getting in the door, making that first connection, that first action step. And so that's what we can do here. If someone is ready to make some steps toward recovery with co-occurring disorders, call us up and ask to come in and see somebody just to get assessed. You don't really have to say why. They might ask you why, but you don't have to say. And treatment at Brooklyn, that's how it begins, by calling in, setting up that initial assessment. And we go through a whole assessment to determine if there is mental illness going on with you, and substance use. And we do in-depth substance use assessment in our in-step program that includes assessing mental illness. And that would be the first step here to getting help. And if you're a person who's not ready yet to work on either one of the mental illness or the substance use, that's okay. Recovery's got to start somewhere. And we are happy to help with anything that you're willing to work on. But know that you can only get so far when you're only working on one at a time, okay? But that's okay. Recovery starts, like I said, with many different pathways. And that's how it starts for many people. Don't know they have a problem with substance use until they've been in therapy for a long time, because they've minimized their use, or they've held on to it because of the relationship with the substance. I talk to a lot of people all the time that are here for another issue, like a mood disorder or an anxiety disorder. And they're recovering from those things with the coping skills we're learning together in the therapy. But then begin to realize, wow, I've gotten a lot better, but I'm stalling here. I'm plateaued in my bipolar illness recovery. And then we start to look at the barriers for that. And a lot of time it is, oh my gosh, you know, I think you might have a substance use disorder. And, oh, no way, I love smoking pot. You know, I never want to quit that. No way. Okay, well, let's keep an eye on it. And you see sometimes, well, maybe that is causing you some problems. This is to do with the plateau. And so becoming willing to work on both disorders gets people the most progress towards that self-directed, healthy, well lifestyle. And so that's true for trauma too. You know, patients dealing with trauma, to get well, you have to find a safe way to process that trauma. But if you come to your therapy sessions and you're processing your trauma, and then at home go and use substances to forget how your therapy went, this is not a safe way to process your trauma. Other coping skills must be developed to take the place of that substance in your life. And so we keep coming back to treatment of both sides of the co-occurring disorders necessary for recovery. So it really doesn't matter what came first, the chicken or the egg. You know, you got to deal with both, no matter how you look at it. But you can start wherever you're comfortable. Oh. Don't worry, Kurt. I'm just looking through my notes really quick. Make sure I didn't miss anything. We can think back to this concept of only treating one disorder, the symptoms of the other might get worse. If we are here working on anxiety, which is my favorite thing, by the way. I think I love working with people with anxiety disorders because there's so much hope for recovery. And not just with anxiety, but with all disorders, there's hope for recovery. But with anxiety, it's just fun for me to work on. And so we think about somebody that has anxiety. I used the example before of someone nervous to socialize. So we'll take it another step further. And this person is nervous to socialize because they might have thoughts that everyone's judging them, which distracts them from really being able to engage. So in these thoughts, for someone like this, they might be so loud in the mind that they might make you act like awkward, or because all you're thinking is, everyone's judging me, I can't. And then someone asks you a question like, what? And that's embarrassing. Naturally, that would be embarrassing. So there's nothing more normal than wanting to take away the feeling of embarrassment. And many people find comfort in substance use because it takes it away. It works on the brain to give dopamine to the person. Feel good neurotransmitters are going through. So this person might feel so good, they're no longer worried about those thoughts, or those thoughts may have entirely quieted. So why would that person seek help then until they start having problems from their substance use? So that's one example of a barrier to wanting to work on the co-occurring disorders. And also, we'll take that same person as the example, should they decide to seek help, but only for the drinking. And they withhold, well, I'm nervous to talk to anybody. I have these loud thoughts in my mind that tell me people are thinking badly about me. They come to try to get help. Oh, I just want to quit drinking. I don't have any other problems. Like, nah, I'm good. Once I just quit drinking, everything's going to be fine. Okay. It might be harder to quit drinking until you learn how other ways to deal with those loud thoughts. For example, cognitive behavioral therapy, learning how to challenge those negative thoughts, or learning healthy calming skills, deep breathing, other strategies to help somebody with that social fear and anxiety that they've been using alcohol or drugs to just cover up. We've got to learn healthy ways. And so it will be hard just to quit the substance until you learn how to deal with your mental health problem. So there's just another point for get treatment for both. I think that wins. I'm blanking just a bit here, everybody. Please bear with me. Kurt, has anyone asked any questions? Is anyone on?
I haven't had any questions come in, but we certainly can be open to any questions that people want to type in through Facebook, and I will certainly relay them to Amanda. Amanda, I have a question for you.
Great.
I heard you say before that with a co-occurring disorder, you probably see a lot more folks with depression rather than anxiety. Is that the case, or is it pretty balanced?
Well, I would say that it's pretty balanced. You know, depression was one thing that is very common. And there are statistics about this on the Substance Abuse and Mental Health Association website, where they have statistics about the most common co-occurring disorders. And so I don't know the exact numbers, but the most common co-occurring diagnoses, that combination of mental health and substance use, is alcohol and depression, and other substances and anxiety. PTSD is another big one with high numbers of co-occurring disorders. And bipolar disorder, borderline personality disorder. These are ones off the top of my head that I know have high statistics for comorbidity. And they're all very common disorders. That's the thing about it. It's not like a rare thing to have a co-occurring disorder. And, I think I have a, let me get it here. So here's a statistic. And I'm not exactly sure what year this is from, but it's within the past 10 years, okay? There have been 43.6 million adults with a mental illness, okay? 43.6. And of those, 7.9 had a substance use disorder and mental illness. And I think I said 9 million earlier, because that 9 million is the more recent statistic. But this is how common this is. And of that 9 million, not all these people are getting help. And so people with co-occurring disorders really need help, and are more likely to get help, but they might just be getting help for the substance use disorder. For example, many people who seek out medication-assisted treatments for their substance use disorder. A medication-assisted treatment would include methadone for the treatment of opioid use disorder, or Suboxone, getting the Vivitrol shot to help reduce cravings, or going to like an inpatient substance abuse rehab. Those kind of treatments just focus on the substance use disorder. And so those people are getting help, but just for that. And so it's important, and many of the places that I've worked with and collaborated with locally here near Brooklyn have a good acceptance of, hey, co-occurring disorders is super common. We need to screen our clients and make sure we're not just offering them substance use treatment, and we're going to at least connect them for their mental health. And here in our InStep program, we are treating both. We're integrating our treatment for substance use and mental health disorders. So everybody who comes here is getting care for both. Unless you're at the place where you're not ready to yet, and that's okay. We got your back when you are.
Amanda, I have a question that came in, if I can share with you, please.
Oh, please.
This person is asking, do you have any tips on how to break down stigmas, stereotypes about addiction treatment? Can you explain some of the direct services Brooklyn offers for patients seeking both services?
Okay, some of the treatments that Brooklyn offers include our outpatient medication management program. And this is where clients come to see like a psychiatrist or a psychiatric nurse practitioner to be evaluated for how medications will be able to help their condition or conditions. At Brooklyn, we offer like traditional mental health therapy, which is meeting one-on-one with a licensed certified counselor or social worker to do that talk therapy. We offer intensive outpatient treatment for clients who have a substance use disorder and co-occurring disorders. And the intensive outpatient treatment is for people who are struggling to maintain or achieve abstinence from substances without structure support. So that intensive outpatient, or we call it IOP for short. It's like 9 to 12 hours a week of group and individual therapy. And also in our in-step program, we have what we call traditional outpatient for those dealing with substance use or co-occurring disorders that don't need as much support, for example, as someone in the intensive outpatient program, or for people who have recently completed intensive outpatient and are stepping down to a lesser level of care. For mental health disorders, as the primary problem, again, we have that chicken and egg issue. But when someone's dealing with a major flare in mainly their mental health disorder, we also have a partial hospitalization and an inpatient psychiatric programs. So stigma, though, I love that someone asked about this. There's a lot that we can do, starting with the language that we use about people who use drugs or alcohol. They're historically, you hear things like that person is an addict, or she's a junkie, or we have these judgments and biases about people who use drugs. And every person, whether you're in recovery or not, can look at changing the language that we use when we're talking. And we try this at Brook Lane. In fact, we have it in our front waiting room here in the InStep program, a list of words that you should and shouldn't use when it comes to addiction. And like that would include like, oh, great, your urine was clean if you're getting a drug test. Well, how about that was just a negative drug screen? There's nothing that implies that there's something dirty about drug use. Shame. Where, like I said before, sometimes there's nothing more normal than using drugs or alcohol to try and deal with major problems in the life. And I'm saying it's normal, but I'm not saying it's healthy. But it certainly isn't dirty. So looking at how you're talking about substance use and people in recovery, I think is the best way to start fighting stigma. That and just the old golden rule, treat others as you would want to be treated. Many people dealing with substance use disorders are really hurting, and they might hurt others in the process, but that doesn't take away their pain from their struggle. So that's how I answer that. I hope that satisfied the question.
Well, I think I've heard people say before, I know what you're saying about the golden rule, but sometimes it's important to have respect and treat people with kindness.
It's as simple as that, no matter who you're dealing with. And we could all get better with that. And so making that a goal each day, that could be a really positive way to grow for all of us. So I might challenge our listeners to try and practice that starting today. And starting to think about, well, what words do I use when I think about someone with mental illness? I try not, sometimes when I'm excited or hyper, I might even say about myself, like, oh, I'm so sorry for being so crazy. That's not nice to call myself crazy. So even not just judging people dealing with substance use or people who use drugs, mental health, mental illness. We really never know what someone's going through. Yeah. So it's something really important we should all be thinking about.
Any other
Better.
questions from our viewers? Please feel free to type in questions if you have them, and I will certainly share them with Amanda. Amanda, do you work with people also in terms of either one of the sides of the co-occurring disorders, in terms of sometimes focusing on gratitude or other supports in the community that might be there for those folks?
Oh yes, I'm so glad you said that. I can't believe I forgot to talk about other supports in the community. So I'm glad that is a question that is asked. Yeah, gratitude is very important. It helps people focus on the positive and identify sources of hope in life and in recovery. And it's so easy to get drawn into negative thinking patterns. And so trying to pull out something that we can be grateful for, even if it's just the smallest little thing that might go right in someone's day. Gratitude can help anybody. And just trying, it can be hard when you're feeling really down to think of anything. But even just one thing, or even if you make a gratitude list, you don't have to have something different every day. You might just be able to identify one thing each day. But the supports for people in recovery need to be there. And that's a goal for everyone that comes to our programs, is to increase the number of supports a person has. Whether that's healthy friends or a recovery group. There is 12-step like Alcoholics Anonymous or Narcotics Anonymous, local in our community in person that people can go to, and you can check it out. Many of us have biases about that, but we would encourage it here. Also now with COVID, and even before COVID, there's virtual support groups that you can find, an endless amount. There's Smart Recovery, which is a mutual aid group that has a cognitive behavioral focus, which is great. There's Marijuana Anonymous, Cocaine Anonymous. Oh my gosh, there's all kinds of support groups that are out there for people, and I would encourage everybody to check it out online or in the community. So yeah, that's a huge part of recovery, is increasing supports.
Is there anything that you would encourage for perhaps family members of somebody who's struggling with substance use or co-occurring disorders?
Well, I would say that I would encourage family members to reach out and talk to somebody, whether it's getting in therapy yourself, or there are some local groups to support families dealing with a loved one with substance use disorder and co-occurring disorders. And so look for that. Don't be afraid to come to counseling just to talk about your family stress, because it can, being the family member of someone struggling with addiction can contribute to anxiety disorders, fear, depression, all other emotional problems for you too. And there was a look, I can't think of it off the top of my head, but recently a couple, I believe, who lost a child, I think, to overdose, started a support group, but I can't think of its information like right now. I have it in my email somewhere.
Well, certainly if somebody were interested in that information, they could reach out to me at Brooklane, either via email or simply call and ask for Kurt Miller, or at kurt.miller@brooklane.org, and I can get that information from Amanda to have it available to share.
And I will forward it to you immediately after
Thank
our Facebook Live event.
Well, Amanda, I want to thank you so much for chatting with us today and being willing to share on co-occurring disorders and help enlighten us in the community about this topic. So, and I think it's certainly timely as being part of National Recovery Month.
It certainly is, and you know, if anyone has any questions for me personally too, I am open to those phone calls.
Great. Well, thank you again. I do want to say to our viewers, we have some programs coming up in the near future that I wanted to share a little bit about. On October the 12th, we will have another Facebook Live program that is going to focus on seasonal affective disorder. Some people refer to that as winter depression or the winter blues. Kind of that time frame where the evenings get dark earlier and the time starts changing and can be a little bit more challenging for some people. So hopefully that will shed some light on that situation. Also, please keep an eye on our Facebook and our website for other upcoming events. National Caregivers Month is November, and we are planning a Caregivers resource fair coming up on October 30th. And this will be followed by 5 different Facebook Live programs that are focused on caregiving in some fashion or other. So that information will be posted most likely on our website early next week. So thank you so much and hope that you all have a great day. Thanks, Amanda.
Thank you.